2026 regular meeting of Board of Health to order. Please join me with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I am Gail Demore, Madam Chair, and with me I have board members Dr. Ed Weiner, Andrea Sheehan, and Dr. Marwa El-Sahabi. In addition, our professional staff are here alongside us. We have Susan Luminello, the Director of Health. We have Michael Green, Associate Director of Health, Christine Mathis, Environmental Engineer, and Marlene Johnson, our Health Agent. Also online, we have we're recording the meeting for our secretary, Ms. Julie Falkingham, to handle our minutes. Thank you for all the work that everyone here does.
This meeting is being transcribed and summarized.
We are, please note we are live and will be taped by BCAT and are available for appropriate comments and questions through this technology. Thank you to BCAT for all that you do for this community, keeping us all so well aware and well informed. We have one approval of minutes for December 9th. I believe everyone here was present. Does anyone have any questions about those minutes or comments? Can I have a motion to approve?
Motion to approve.
Second. So we have a motion by Andrea Sheehan and a second by Dr. Marwa El-Sahabi. All in favor?
Aye.
Aye. Is there anyone here in our audience and/or online that is here for citizens' time? Someone who's not part of the agenda but would still like to speak to the Board of Health?
Yes.
Could you come on up and sign in and introduce yourself and state what your matter is?
Hi, my name is Orysia Hanyashevsky. I'm a long-term Burlington resident, and I'm seeking the nomination for the open Board of Health position. Part of my experience includes 30 years in biopharma across companies like Pfizer, Biogen, Boehringer, and I have epidemiology coursework as well as clinical trial and portfolio management in many, many disease areas. So I'd be very interested in hearing about your work and submitting my signatures for the nomination.
Lovely. Thank you for being here. Thank you for introducing yourself and for running. This is exciting.
Yeah. Thank you very much.
Can I, Susan Luminello, I'm the director. I can, if you want to come by the Board of Health office, and if you have any questions, I'd be happy to meet with you, and I can fill you in on, everything that we do if you'd like to.
Thank you very much. I sat in on your Tri-Torn meeting.
Yes.
And I was very happy to hear the presentation by Rebecca.
Yeah. So if you want to just email us at boh@burlington.org, we can arrange a time for you to come in.
Very good.
In addition, feel free to call, speak for any, call any of us on the board.
Thank you.
I'd be happy to have a
being so
conversation with
welcoming.
you. Yes.
Okay.
It's nice to put a name and a face together.
Thank you.
Did you have anything else specific that you wanted to ask? Do you have any other questions?
No,
or
I do
comments?
not. Thank you.
Thank you.
Thank you for being here. It's nice to put a name and a face together. Next on our agenda, is anyone else in the audience here that's not on the agenda? You guys are all here. Anyone online?
She's not on the agenda.
Okay.
She raised her hand. I don't know if she's here for citizens' time now.
Are you here for citizens' time?
No.
Yes.
You're on the agenda?
Hours like for school.
For school,
Oh, okay.
nursing hours.
So you're sitting in, okay. Thank you, thank you.
Thank you.
So then we're going to move on to the chairman's report. Wow, 2026 sure has come in hot. Often the new year marks change for most, and for us, we've seen a lot of things come through this January. First and foremost, for our board, we did have a resignation of a longtime board member, Maribeth Welch. I am sad to see her go, but she has some big news of her own, which I don't think she'll mind me sharing. She has officially become a grandmother. We will, at some point in the near future, have a more proper send-off and a congratulatory celebration for her here at the next couple board meetings. For now, I think she would just like to know that we're all thinking of her, and we wish her well with her new family role. A huge win for the Patriots came in, and a major snowstorm have hit this week, and I think there's a little more snow in the forecast towards the end of the week. So it is a good time to remind people to be checking in on those who can't get out on their own, who might need help with just grocery deliveries, shoveling, and all of that, snow removal. It does take a community to make sure that everyone's able to stay safe and be well. So that's all I really wanted to start off with, our first meeting of the year. With that said, we're moving into subcommittee notes, so I have an update in public health with Dr. Marwa Shahabi.
Thank you for the update, Madam Chair. So tonight I just wanted to kind of go into the matter of flu, because we're at like the peak of flu season, we're seeing it everywhere. And I find that, I get this question all the time by patients, but I find in general people are kind of like skeptical, is the flu vaccine going to make a difference? We all know that the virus, there's antigenic drift. So in other words, that virus has lots of variants. It's difficult to cover every variant in the vaccine. But we do know, we have like over 500 observational and studies, trial studies that have been reviewed that show across the board for flu A, B, for COVID, for RSV, there's over 50% effectiveness that keeps patients out of the hospital. And so I'm going through this a little bit tonight because I've just seen so much of it lately. There have been deaths in the community. And so I feel very strongly that if you can get it, get it. The only real contraindications to not getting the vaccine are a severe allergy to prior vaccination. So if you have an egg allergy, you can still get the vaccine because the egg is in such small quantity, it is not going to cause any reaction. And then we have patients, if you're over 65, you're highly encouraged to get the high-dose vaccine. That is very important. If you have cardiac disease, like heart disease, if you have lung disease, right? If you have heart failure, the virus can actually trigger a heart failure, acute heart failure exacerbation. So just keep that in mind, talk to your loved ones, encourage them to get vaccinated. And the other thing is, I just want to thank our nurse, Susan Torini. She's done such a great job with keeping people in the community vaccinated. We are, again, seeing measles outbreaks in part of this country, which should have been eradicated. It was back in the 1960s when the vaccine first came out for measles. And I just want to make sure that, our children are safe, pregnant women are safe, the people who are at highest risk, there's streams of age for morbidity, which is disease related to measles, and mortality, which is fatality, right? So it's really important to get people vaccinated. Thank you.
Thank you very much. Very nice.
Great, thank you. And we also have a quick wellness committee update. Dr. Marwa El-Sahabi, myself, and Susan Luminello attended the last meeting on January 15th, where the group was primarily spending our time evaluating the lower elementary K through 12 curriculum standards for health and PE. And our next meeting is focusing on continuing that work at the upper elementary level, and then we'll eventually move through middle school and high school curriculum topics and things with the Mass state standards. Moving on to our agenda, we have one permit, keeping of animals at 6 Luther Road. Welcome. Please come on in, sign in.
Sure.
Introduce yourself.
Oh, thank you. So 6 Luther Road, I'm Bevan Nichols.
Nice to
And
meet you.
just for the record, there is a typo in the paperwork of Ms. Nichols' first name. It should be spelled B-E-V as in Victor, I-N.
And could you
Evan with a
please
B.
pull the microphone a little closer to you?
Sure.
Thank you so much. Perfect. Thanks.
Yeah.
So Ms. Nichols is before you tonight requesting a keeping of animals permit for the keeping of hens. The applicants, she and Mr. Nichols, are receiving a coop, run, 6 hens, and other accessories, and there's some photos attached, from someone who must rehome their hens before February 1st. And just so you know, they are there now. And after the Board of Health approves the permit, the coop and the hens will, they have arrived, and the inspector will contact them to schedule an inspection of the coop, like she normally does, and take measurements. So we do have a copy of the plot plan showing the location and setback of the coop, photos of the coop and the run, feed storage plan, which does not attract pests, manure management plan, which does not cause a nuisance, and turf management plan. So again, I just want to explain to the board the reason why she has the hens in the coop now is because they were rehoming them from somebody else and needed to rehome them before February 1st. Normally, we don't allow that, but under these circumstances, we allowed it. So the action by the board, you may vote yes to approve the keeping of animals permit for hens for Mike and Bevan Nichols, 6 Luther Road, with the following conditions. 1, contact the Board of Health no later than February 9th to schedule an inspection. Inspection shall be conducted no later than February 28th, and I'm giving you that window just because we don't know with snowstorms and such. Notify the Board of Health in advance before increasing the number of hens. The coop shall have adequate space for hens at a minimum 2 square feet per hen, not including the nesting box. Do not purchase or acquire a rooster or cockerels. Renew the keeping of animals permit 30 days before the expiration date. Allow the Board of Health inspector to schedule and conduct a compliance inspection. This permit is approved for applicants noted above and is non-transferable, and violations of this permit may be subject to penalties as noted under Section 2.7 of the Burlington Board of Health Minimum Standards for Keeping of Animals Regulation, or the board may vote not to approve the keeping of animals permit.
Are there any questions?
I was just curious if there were any abutters that were concerned.
We haven't heard from any abutters.
Anyone in the audience in a butter? No?
My chickens. I ask this to everybody.
Why chickens, you
Yeah,
said?
well, why do you want, we have a lot of chickens in town. So why would you like, why you?
So a friend of mine has them, and she loves keeping them, and I mean, I make fresh bread, why not have fresh eggs, get all the natural things going on in our own yard, so yeah.
And they're being rehomed to you? So
Yeah, so we're technically adopting
Not
them.
under duress.
Yeah, no, the family is moving, and
Okay.
they cannot take them with them to their new home, so their kids are not happy, but my kids are.
Well, yeah.
Yeah.
Very good. Any other questions, Doctor? Anyone? Your answers?
I'd like to make a motion
Right? What is
that we approve the keeping of chickens for, I want to get the,
The address is 6 Lutheran.
yes, for 6 Luther Road, keeping of animals, hens. You understand all of the, and you accept the the conditions.
Absolutely.
You'll go afoul.
Nope.
So I make a motion that we approve.
Second?
Great. We have a motion from Dr. Ed Weiner and a second from Andrea Sheehan. All in favor?
Aye.
Aye.
Aye. Welcome.
Thank you.
Congratulations.
Thank you so much.
Thank you for coming.
Great. Next on on the agenda, we have a variance, an external grease inceptor at Naya on 112 Burlington Mall Road. Who's here for that? Great. So if you could sign in and then just introduce yourself.
Right. My name is Agus Gomez.
Could you-
My name is Agus Gomez. My nickname Joe. I'm the area manager for the Naya company. I supervise right now all the Boston one location. So far we have 4, 3 in Boston, 1 in Arsenal Yards. Here, hopefully, is the next one.
Great, and you've been working with Marlene, so she can give us some background? Thank you.
So Mr. Gomez is representing Naya this evening to request a variance from the external grease interceptor. And the type of food, I included the menu. The type of food that's served is Middle Eastern. The variance is from Section 2.3, Part A, which requires installation of an external grease interceptor. The application is attached to your paperwork. The Board of Health may vote yes to approve the variance from Section 2.3, Part A, and allow the new food establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner both understand that the Board of Health may revoke, modify, or suspend this variance if, in their opinion, the level of protection is not equivalent to that provided with a strict application of the Burlington Board of Health Regulations 2.0, grease interceptor requirements for food establishments. The food service establishment shall be notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that the food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increase maintenance of sewer lines. Or the board may vote no, not to approve the variance. I'd also like to mention that the gentleman that is here virtually is also representing NAIA. He's out of state, so that's why he is here virtually.
Oh,
He's the
Hi, I'm Paul Bayham. I'm the Director of Construction. So between operations and myself, we can kind of cover any questions you have.
Great, thank you for being here. Does anyone have any questions?
I have a couple, Madam
Okay,
Chairman.
great.
I'm sure you understand why you need a grease trap. I'm sure you're an experienced professional. You also need to know, and I ask these questions of almost everybody who comes, are you aware that you need a very detailed log for the grease trap?
And this would be for the inside grease trap. The variance is for the outside grease trap.
Oh, if it's for an outside grease trap?
Correct. External.
External, this is, okay.
Yep.
Well, with that, you know about the maintenance of the external grease trap,
Yes.
okay? And the other question when do you intend to open? Where is the address? This is your time for a commercial. Where is the address? Where's it going to be?
Hold on, let me pull up the full address here.
I'll help you out.
So the address it'll be 54 West 56th Street in Burlington, and I mean, like, we can't wait to be a part of this community because, like, I'm kind of familiar with the area because I was working on the company before. I was on the Burlington city. I was here, like, I love the areas, and I joined this company when they said they're gonna open Burlington. I was very excited. So, right now, we're looking for, like, beginning of June, the grand opening, and I hope you all will be there with us.
And what is your main dish? What is your fare? It's Mid-Eastern.
Okay, it's we do like fresh bowls and rolls, and beverage as well. We don't do alcohols. And if you trying to get a lunch or a dinner with your family with like very fresh Mid-Eastern food, we are the place.
Thank you very much. And you have no objection? I always
No, and I just wanted to mention, they're going into the plaza where Wendy's and Duluth are located, so
okay.
112 Burlington Mall Road.
Yes.
They're
Yes.
Supercuts, yeah.
Thank you very much.
Right.
Any other questions? The menu looks good.
I know, I'm excited.
Okay, so I guess I need a motion to approve the external grease acceptor at 112 Mall Road.
So moved, Madam Chairman.
Second.
Great. All in favor?
Aye. Welcome to Burlington.
Great. Welcome
Thank you
to
very
Burlington.
much. Thank you very much.
Thank you.
Very
Thank
good.
you.
Thank you for being here, Paul. All right. So that was our only variance for today. There's no hearings, but we have a couple discussions. One, the plumbing variance was withdrawn, so we'll address that when it comes before us again. We have a Board of Health reorganization due to the resignation. we'll have a group discussion on how we want to proceed forward. Susan, do you want to talk to that matter, or?
Sure. So when we got the resignation, we contacted the town clerk's office, and Gail contacted the chair of the select board to find out what next steps were for getting a board member in. So in those discussions, it was determined that the board can decide the board has to notify the Board of Selectmen of the vacancy in writing. And then the board can, because it's so close to the election, board can decide to wait until the election comes up instead of going through the full process of the Board of Selectmen voting on a candidate. Because otherwise, if you would need to go that route. But because we are so close to the election, the board can function with a 4-member board, then you can wait till after the election. So I drafted a letter that Gail has to go to the select board tomorrow to notify them of the vacancy, and if the board so chooses tonight to vote that way, to wait until after the election for the new board member.
And to the timeline just didn't seem to make sense to do an appointment.
Right.
Because by the time the appointment happened, it would be like 1 or 2
Yeah.
meetings, and then there's an election, so we'd have to see.
And we can function efficiently as a 4-professional member board. So to that end, as you know, I make some calls, and we talked about it. I think that's the best way to go, that we, that maybe tonight that we will nominate and to appoint a vice chair for the time being before we reorganize a second time in April. But to that end, I agree with you, and I agree with, and I think, I see nodding, so I think we all agree that it's not necessary for us to go to advertise and then to go through a meeting, a joint meeting, and to bring someone in for a possible, one meeting?
1 or 2 meetings, yeah.
I agree.
Do we have to vote on that?
Is this,
Yes.
so this is an official vote?
Because in that letter, I do state that the board voted, so.
True. Okay, so then I need a motion to proceed accordingly until April as a 4-person board.
Approve.
I
Motion to
second
approve.
that.
Okay. All in favor?
Aye.
Aye.
Do you need us to sign this?
Yeah, Gail.
Just
Gail-
Does
initial on
everyone
it,
need
just
to sign
initial
it,
our
or just
names
me?
You can, it's up to
Do
you.
we need a
initial
roll
on it.
call vote on that? I would suggest that we do a
just
roll
says
call
when.
vote just in case somebody
I think I
somebody
just had to
has a
give a
problem with
written,
this.
well, this
Madam
is who
Chair?
it's to.
I think, I suggest, just in case that somebody has a problem, that we do a roll call vote on this. and
Just to be super clear.
Just to be
and official.
absolutely clear that there's no issue here.
I'm fine with that.
I'm okay with that, too, so
So just
a
call
roll
the name.
call?
Yeah, call the
So, Andrea
Oh.
Sheehan?
Aye.
Aye.
Aye,
Ed?
okay.
Okay, and I'm aye. So we're all in favor.
All in favor.
Individual roll call done. I'll sign this and we can get it over to the select board
Mhm.
tomorrow.
Yes.
Okay.
I'll email it over tomorrow.
You can
Okay, great.
email it.
So
or
do
you
I
really
need
should
to
walk
sign it?
over.
You
Somebody
can do
should-
that. Yeah.
someone
Do
really
we
should
have
walk
to
it over.
sign it, or does Gail just sign it?
Well, Gail can just sign it.
Okay.
I
because
guess
In
so.
it says that the whole board voted, so.
That's fine, it
says
just
the
has her name,
board
so I
is-
wanted to be
yeah.
clear. So we're good.
All right, good. The second matter with this discussion is the reorg. Do we do that now?
I think so. We call for nomination.
Do I have any nominations for, Maribeth was the vice chair, so we have an open vice chair spot if someone would
Yeah,
like
I'm
to.
proud to nominate Andrea Sheehan as vice chair of the Board of Health.
Great, great.
Great.
Would you
Thank
accept?
you. Yes.
Oh, good, I'm glad. Well, thank you. All in favor?
Aye.
Aye. Very good. So welcome to your new position.
My new chair.
Very good. Okay. Next on our agenda, or for second discussion We have a foodborne illness presentation by our health agent, Marlene Johnson.
Yes, so if you want to follow along with me, unfortunately, we don't have the
Yep, I'm going to
the monitor. I'm hoping maybe it'll show up on BCAT's copy. But, so I am providing this presentation just so the board understands how the inspectors, we conduct a suspect foodborne illness and what our inspection protocol is. Okay, going to the next slide.
1 second, Marlene.
Okay.
I just, get to share. Oh. Oh, there we go.
It is in the
Oh,
packet.
there we go, we got it. Okay.
Yeah.
Okay, so you have it there, okay. Are you all set, Susan?
Yep,
Okay.
just let me know when you want me to move the slides.
Oh, okay, so I'm on slide 2. So foodborne illness is an illness caused from consuming contaminated food or beverages. Next slide. A foodborne illness outbreak, and this is the definition from the Massachusetts Department of Public Health. It's an incident in which 2 or more persons from different households experience similar illness resulting from a shared food. Next slide. So how we receive suspect illness complaints, we receive them 2 ways. So we either receive it by a phone call directly to the Board of Health, or we receive it through MAVEN, which is the Massachusetts Virtual Epidemiological Network. And how it ends up through MAVEN is sometimes a citizen will call the Massachusetts Department of Public Health directly instead of us, or the citizen went to a doctor and is positive for a foodborne pathogen. And so if they live in Burlington or they consume food in Burlington, the case is shared with us. Next slide. When we receive complaints of suspect foodborne illness, a Massachusetts Department of Public Health foodborne illness complaint worksheet is filled out, whether it goes to the state or whether it comes to us. And there's a 2 or 3-page form. The information that is gathered is the name, address, age, occupation. We ask if they sought medical attention, did they submit a stool sample. We obtain a 72-hour food history. It is not always the last meal consumed that causes illness. The contaminated food may have been consumed several days before the illness symptoms began. We also collect the date and the time the foods were consumed, how many people ate the same food, how many of those people were ill. If they were ill, we gather their information too. Are ill persons from the same or different households? What are or were their symptoms? And what date and time did symptoms start? And what date and time did they stop? So we have trained inspectors who will do the investigation. So when we gather all the information, we're analyzing it. So we're asking ourselves, is it an outbreak? Do we have a confirmed pathogen? What pathogen do we suspect? Sometimes based on the symptoms and the incubation period, and sometimes even food that they consumed, we can kind of guess what kind of a pathogen it might be. That helps us know what foods we need to focus on and what food prep or practices we focus on when we do our investigation. So when we do our investigation, we're looking for contributing factors. So we do a hazardous analysis of critical control point risk assessment. We look at their standard operating procedures. We look at risk factors. And we find out if employees were out sick. And the HACCP risk assessment, it's basically a flow of foods. And this is what the form looks like here. It's multiple pages. And the flow of food. So when we go in and do our inspection, we're starting all from A to Z. So we're looking at how was it received? Was it received under refrigeration? Was it received frozen? How did they store it? Where did they store it? How did they prepare it? And then we have these other items, cooked, cool, reheated, hot holding. These are your critical control points. So this is if these fail, this is where bacteria growth can happen. Growth or proliferation, meaning that it's extended time temperature abuse can grow bacteria as well. So cooked, was the food cooked all the way through according to the minimum standards of the food code? Cooled, were foods cooled in the proper requirements, again, in the food code? Reheated, are they reheating the food according to time and temperature that's outlined in the food code? And hot holding, is food being held hot at proper minimum temperatures? So if contributing factors are found, we do corrective actions, we do intervention strategies, we provide education, and we order employee retraining if necessary. Standard operating procedures, we may have them make some changes there if we feel that that's where the breakdown is. And in extreme situations, we may have to have a cease and desist of a specific action or process if we feel that it's being conducted unsafe. Any questions?
I just have one quick one because I know this is like not a common thing that happens, but it's I feel like it does happen. And this is why it's so important for the restaurants that come before us to keep their logs in order, just so that you have the information to be able to help them correct.
A lot of it's observation, too. You know, when we go in and we, for example, if somebody said that they believe they got sick from eating chicken, so we, as I mentioned, how is it received? Where is it stored? Okay, now it's time to cook. Go ahead, cook it, you know? And sometimes that's where we find a problem, is that they're not cooking it all the way.
Okay.
So like I said, a lot of times
hard to
it's observation. You know, we go in, we watch, you know, do we see employees washing hands when they're changing tasks, things like that. But we do look at logs, absolutely. So especially when it comes to cooling foods, that's key. is
Recording
to see those, because the cooling we're not always able to see.
Right.
So the logs do come in here.
And is it common for one person to get food poisoning from an establishment or without anyone else getting it? Is
It is-
that like common?
It's not common,
Okay.
but it is possible. And
Okay.
again, if I were to use the raw chicken cook, maybe somebody didn't cook the raw chicken to 165 degrees Fahrenheit for 15 seconds, maybe they undercooked it, it went out, somebody ate it, especially if they have immune deficiency.
Right.
They're going to get sick.
Okay, thank you.
You're welcome.
Just for the record, for people who may be watching, routinely, we require a food safety manager present at every food establishment that is preparing foods. That is very different from many of the communities that I know about. We require them to be there, and we have fined some of them because they have not been there. So we have somebody who understands that. Second, you do a tremendous amount of training. You always have, And third, goes along with two, and that is you are vigilant. I mean, you are absolutely vigilant. You go in there as well as Ms. Ellsworth, and you really take names and look in, I shouldn't say, and really make sure that everything is appropriate. If not, they're here in front of us
Right.
very quickly.
Right, exactly.
So I can say for the record, because I've been here for a couple of years now, 37, that a lot of the complaints are found to be no violations. So over your career here in Burlington, what percentage? It's got to be extremely low. How many suspected foodborne illnesses have really been
Confirmed.
fruition,
Or
confirmed?
found a smoking gun, so to speak.
Very few, that you're absolutely sure.
Very low, probably less than 5%, and then, yeah, it's very low.
It's very low,
Very
because
low.
I've said this, and many of us have said this, you can eat anywhere in Burlington safely. And that's what I want, make sure everybody understands that this is a great presentation, and we
Excellent.
know, but it's like fixing flats, how to fix a flat.
What caused it?
What caused it is very difficult. However, it's nice to know that there's a process that you can fix it. But I haven't had a flat tire in 25 years. Thank you.
Well, thank you. Great
Welcome.
presentation. Does anyone else have any questions, comments?
That was going to be my question. I was curious about.
Okay, good. So we're all set with our discussions, and we're moving on to staff reports. We'll start with environmental engineer, Christine Mathis. You have an overview for us?
Sure, just a couple of things. Currently in the process of doing the biological safety permit renewals. They're all due at the end of this week, and they expire at the end of next month, so I'll spend the month reviewing 300-page renewal applications. And, thankfully, most of it's resubmittals, but, so that's underway. And then Dr. Weiner was asking me earlier, the next scheduled household hazardous waste day is May 16th.
Oh, great.
Okay. Do you have any questions on my report?
And if I just have one, in Styler, will they be coming in front of us?
No, they don't require a biological safety permit.
Okay, thank you.
They're not doing any rDNA or genomic or genome manipulation.
Okay, thank you.
Oh. Any other questions? I didn't have anything. Did you? Okay, I need a motion to approve the environmental engineer staff report by Christine Mathis.
Motion to approve.
Second.
All in favor?
Aye.
Aye. Great. Now we're looking at health agent Marlene Johnson. Staff report overview.
Sure. So I do want to point out, we did issue a criminal fine to Town Pantry located at 85 Wilmington Road for selling, or I should say, offering for sale a flavored tobacco product, failure of a non-age restricted retail establishment to maintain a record of documentation submitted by the manufacturer. That letter proves that the product is not flavored, didn't have any documentation. And failure to maintain record of documentation submitted by the manufacturer certifying that such tobacco product does not meet the definition of a flavored tobacco or tobacco enhancer. And the other one was nicotine content of 35 milligrams per milliliter or less. So since this was issued, he is working with our shared services tobacco control inspector, and he's getting all his documents in order. Again, the documents state whether or not that particular product that he sells is a flavored product, or if it's a vape product, that it doesn't contain more than 35 milligrams per milliliter of nicotine. Anything that he doesn't have letters for have already been removed from the premises.
And you warned them. You had warned them.
They received the fine. Oh, yeah, they, twice before, she was in there, that was the third follow-up, that, when it was issued.
So this is the first offense, though?
It is the first offense.
Documented,
Yes,
okay.
yes. Any questions on my,
Mr. Chairman, could we also include in that the associate health inspector for any questions there, too?
Oh, yes, I'm sorry. I had it under Susan.
that's
Sorry.
okay. Were there questions for,
Anything on, there's also the Associate Health Inspector Samantha Ellsworth's report. Was it included under Marlene's? Are there any questions there? I didn't have anything, did you?
No. I move that we approve the health agent's report, which includes the associate health inspector's report also.
Second. Second the motion.
All in favor?
Aye.
Thank you. Thank you. All right, let's see. And now we have Associate Director of Public Health, Michael Green.
Yeah, Madam Chair, it's not on my report this go-round, but we did have a fantastic conscious, unconscious bias training last week
Cool.
for the BVRC.
Okay.
It was led by Dr. Shamala Khan again, and that one is
Well
always a
attended.
really good training for folks.
Very good, thank you. Anyone have any questions
I just have one, and there's a comment. It was pretty cold here this week, and I was wondering about a warming center. I didn't see any notice about warming center here. Is it the fire department? I know you work closely with them, Mr. Green, makes that call, not us?
Correct. They have the emergency manager, so they would ask for our support when they wanted to stand up a warming center.
Okay. And then the second question is, you want to say something? It's the first time we're going to have some active shooter training.
Yes, so contracted with Safety Analytics, and they're going to be doing 2 classes for us. The first one coming up Wednesday, February 11th, I think 5:30 to 7 at Grandview. They're going to go over kind of active threat assessment, kind of workplace violence, situational awareness type training for folks. It's the old Lieutenant Glenn Mills conducting the training, so tried and true trainer there, so that should be a pretty good one. The other one, I believe, is, if I'm not mistaken, it's in April, I think around April 12th, maybe.
Anyone have any other questions?
Can I ask a quick question?
Of course.
Just on the note of the heating center or the warm area, was that done at the rec center at some point, or was that I seem to recall something like this last year. Maybe I'm completely wrong.
Maybe you think of the cooling
We
center?
had cooling centers.
Maybe it was the cooling
Over the
center I was
summer,
thinking.
yeah.
Because they
It
did
is
have
in
the,
our building, it's
that's what I was
Center
thinking of.
Street.
Because they did have that for the extreme heat.
Yes, and we did have MRC volunteers during, like, when there was no
Yeah.
staff in the building.
I see. Thank you.
So a heating probably would come into place if we had extreme outings, like,
Yeah,
you know,
I would think that
electricity
they
or
wouldn't
We didn't-
open up
Yeah.
a warming center unless you had significant
Outage, yeah.
power outages. And then
Which
even
luckily
then,
we didn't.
you wouldn't do it immediately. You would have,
Right.
because you wouldn't want people coming out in
Right.
the middle of a snowstorm.
Right.
Well, that's a hard timing.
Right, right.
Yeah, that makes sense, though, too.
Yeah.
It did cross my mind as well. Any other questions? Thank you for all the hard work that all of you do. There's a lot here. There's a lot here. All right. A motion to approve.
We motion to approve the Associate Director of Public
Yes,
Health.
thank you.
I second.
Second by
All in
Maura.
favor?
Aye.
Great, thank you. And lastly, we have Director of Public Health. Let me look at my notes. Which includes Susan Luminello's report, which includes the supervisory nurse, Sandra Trioni, and shared services report.
Yes.
Want to give us a quick overview?
Sure. So one thing I wanted to draw your attention to, Sandy and I were asked to go on BCAT to talk about the flu season. So we ended up talking about some other things too. So it's about the flu, and then Phil Gallagher was the interviewer and asked other questions as well. So it went well. Sandy did a great job, and I just wanted to point out I put some statistics together for you from the Department of Public Health data dashboard on influenza. So we did talk about some of these slides, and they put them up on BCAT. But just for your own reference, I was anticipating questions about comparing, the different flu seasons to last year and the year before, the peaks. So in this, I have, the first slide is on emergency department visits, because that's how Department of Public Health collects the data, because that, otherwise you wouldn't know, because not everybody goes to the doctor or whatever, if they might not even get tested. So this is how the data is presented. So as you can see from the first slide provided in your materials, we had the peak, and now it looks like it's starting to go down. And last year, our peak was a little bit later in the year. So if you're looking at this year as compared to last year was also a high flu season, and lots of emergency department visits. And the peak was a little bit later than it was this year. And then also, I looked at some data for vaccination rates. So the current season, as you can see from the graph, the vaccination rates for this current season is below all previous seasons. I pulled some numbers for Burlington residents, and Burlington is doing a little bit better than statewide. So that's good, except in, I believe it was one category here. It was the
Under 5.
under five? No, 48% for Burlington, 40%
That's
for
correct.
states. So we were good on that one. And then there was
80, oh no,
We're good.
67%. Oh, it looks like we're doing
All of them.
all of them. Yeah.
That was that one, yeah. No.
And then also collected some data here on the types of strains that are out there that you previously talked about, Marwa. This is based on data that goes to the state lab. So anybody who gets tested and the state lab does the analysis, you can see the different types of strains that the state lab had identified. So it looks like in this one, the seasonal type A, or the H3N2, was the most prevalent one. However, I wondered about that because I was thinking, well, that's the one that most people are gonna, maybe you can answer this, Mara, I was wondering it myself. Is that the one that most people are gonna end up in the hospital for, and that's why the result is going to the state lab?
Most likely.
Yeah.
There probably is some, like, bias in there, right?
Yeah, yeah. So, and unfortunately, they can't test everybody, these are the only.
not everyone
Yeah.
goes to the doctor when they're sick.
Right.
Which,
And then the last slide I have here is on the influenza-related deaths. So this compares this year to previous years so far, 112 in the state of Massachusetts. Last year, at the end of the season, it was 470, which was also a high season.
that's a lot.
So I don't know if anybody has any questions on that or my report.
Can I ask a question? So, for the high dose, for the over 65, I think we were doing relatively well with that one. So was that the one,
Yes, so
we finished those?
all the high dose that we had, we gave out.
That's good. at least.
Yeah, yeah.
That's good.
And we have a small number of regular dose.
Yeah.
I haven't really had it. We were at the Civic Expo giving out vaccine. I think we brought, I don't know, I think we gave out 5 or 6. Not a whole lot, but
At least the high dose
yes.
was not finished.
And Sandy will be coming to the meeting, a meeting in March to talk about next year's purchase and what we want to do there for the high dose. We got less high dose this year
I know.
than we did last year. But as you can see, less people are getting vaccinated.
Through us or in general?
So that I don't know. So these numbers are for what the state collects. So
Okay.
they're collecting it from everywhere.
Okay,
not
so if
just
someone goes
from
to
boards of
CVS, they're included in the state
Right,
number?
right,
Okay.
yeah. Now, if we look at our numbers,
Yeah.
from what we've given out, yes, we've given out a lot less. I don't know, that could just be a reflection of less people are getting it, or a reflection of less people are coming to us to get it.
Right, it's hard to say.
Yeah.
Everybody's giving it out.
Yeah, and also too, I hear from people, we have to use the color software. So people start filling out I don't know if any of you've done it, but, it asks a lot of questions. The state asks a lot of questions. So people don't want to go through the big survey, putting in all the answers to the questions when they can just go and nobody asks them any questions.
Yeah.
Right.
So I think that's kind of, I pointed that out to the state because, they're pushing for, boards of health can give out flu vaccines so that they can fund their public health programs, and that's great. However, the state should be encouraging people to go to the local board of health to get their vaccine. And
Correct.
if there's those kind of barriers, then people may not want to do it.
People aren't going to be interested.
Right.
That makes sense. Any other questions?
Just one, if it's okay?
Yeah.
I saw in our reports for the first time a mention of the health fair. Do we have a date for the health fair?
Yes, we do. Do you know it offhand, Mike?
That's going to be April 25th.
There we go.
April 25th.
And that's a Saturday.
Okay.
And so for that, we are in the planning process. We have the application for any exhibitors who want to come on our website. We
Great.
put, advertise it in the paper, BCAT, et cetera, for anyone who wants to fill out an application. And then we'll collect all the applications, and then in the March timeframe, we'll let people know, whether or not they got a spot.
Are you still planning at the high school?
Yes.
Good.
Motion to approve the Director of Public Health's report.
Second.
All in favor?
Aye.
Aye.
Aye. Very good. Do you have a shared, did anyone have anything about the shared services report? Okay. A motion to end the meeting?
Motion to adjourn?
That was
Adjourn.
second.
All in favor?
Aye.
Aye.
Aye. Great.